Alright, Inbones here, and you're looking at my go bag. And if you watched any of the earlier videos, this thing's getting a little full. And I think it's pretty much getting to a point where I'm pretty happy with it, and I'm going to leave it alone. And that leads me to want to update some of the other supplemental videos I did. So this is going to be an update to the trauma kit. Now, a lot of the information is going to be the same, but I have added a couple key things to it. And so I'm just going to go ahead and make this a standalone video. So if you've never seen the other one, don't worry about it. This one will cover everything. So the first thing is I run the Condor EMT pouch as my trauma kit, and I kind of like it because if you unhook this hook here, you can actually pull it away, and it's mollied on. The molly attachment is actually just a big sheet of Velcro. So, and also in here I have my CPR mask. So, and that should be it. Everything else is first aid. So let's go with these items here. And I really dig this Condor kit. Like, you can never really run this on a vest or anything, but on the side of a bag or something on there, I think it gives you adequate room to really get in depth into some of your supplies. So this is about what I'm going to be running. And I'm going to go through this in kind of a particular order, but kind of top to bottom also. Really, when you come across, what are the two most likely things you're going to come across? If you shoot a lot like I do out in the desert and stuff, maybe a gunshot wound or a burn or something like that. And the burn could most likely be taken care of with your first aid stuff. But gunshot wound or a car accident, and especially if you're out in the middle of nowhere, this could really save someone's life. So your biggest concerns are going to be, can they breathe, their airway, stopping the bleeding, and is their blood circulating, like CPR and stuff like that. So do they have a pulse? So I think everyone should have one of these, and this is just one of the CPR masks, and this is a pretty good one. It comes with gloves and stuff already in it. And why have a mask? Well, you don't know the person. Well, maybe you do. Maybe it's one of your buddies. But if it's a car accident or something, you don't know that person. And what if it's a drunk driver? Like, do you really want to be exchanging fluids? Hell no. So this is a good way to protect yourself. Also, when you first come across it doesn't matter if it's your buddy or not, unless it's your own child, like, always use gloves. And I've got, I should have 3 or 4 pairs in here. And the reason why I have so many pairs is, you know what, you might have someone helping you out. So it's good to have, like here I have 3 pairs. And if there's multiple people that are hurt, you're going to want to be able to take care of them. So glove up and protect yourself. So gloves, CPR mask. And that kind of brings me to, well, let's just stick with the Airway theme here. I carry these J-tubes, and you can get them on Amazon for pretty cheap. I think it's $5 for a set, and I kind of divided the set up. And there's good videos on YouTube on how to deploy these. Basically, you put it up, and it's meant to keep the tongue from closing off the airway if they're unconscious. So basically, you're going to put it up in the roof of their mouth and rotate it 180 degrees as you're getting it in there, and it's going to push the tongue back down. And you're going to need different sizes for different sized people. So they sell little kits. They're like $5. Not a big deal. So next, nasal tube with some type with lubricating jelly. Like, you don't just have the tube with nothing to like, you need it to slide down in there, and that's basically also a 180-degree turn. And there's some wicked videos of this on YouTube of guys in the military actually putting these in themselves. So, you know, I've given myself an IV, but I haven't gone so far as to give myself a nasal tube. I don't think I'm gonna either. So, along those same lines, you know, here's an extra little folding mask that you put out and lay across their face. I like to be prepared. Also, if it's a gunshot wound, or, you know what, even, I remember seeing a thing on the news, and a lady actually got her lung punctured by a swordfish, deep sea fishing. So, this is just a chest seal. Basically, you can use any type of plastic. Like, if you had to use one of the baggies from this stuff to cover that wound and allow them to breathe, just, you know, do what you got to do. So that's mainly the breathing stuff. Let's go on to the bleeding stuff. I got all kinds of bandages in here. I really like the Israeli bandages. I have 2 sizes. Pretty compact. They do a really good job. Plus, I have some of the older school bandages from when I was back in the Army. And that brings up a thing, you know, a point I wanna show you. This is an old eye dressing kit for someone, you know, got shrapnel in the eye or something. You know what? Check all your packages for expiration dates, because this, you know, I was still carrying this around, and I just happened to be looking around, and let's see, where's that expiration date? Because it kind of cracked me up. October 2004. So I'm not going to be using that. So just, you know, there are some things you need to, you know, check the expiration date. So back to the bleeding. I also have normal gauze and quick clot. You know, I kind of read something about this being somewhat of a pain when you actually get to the emergency room. I don't know exactly what it was saying, but look, if you're really bleeding out that bad, use it. If it's a pain in the ass for the doctor, who cares? You know what? You made it there. You made it to the hospital, and that's more important than frickin', you know, not making it. So let's see. I think we got everything out of the top here. Trauma shears. You know, your knife's not going to be able to do everything. These weren't that expensive. Get a good pair of trauma shears, alright? And then I have a needle that's left over from an IV kit, which is one thing. The last thing I'm looking to put in the bag is an IV kit, and I just haven't got around to it yet. But and then I got a couple things in here. Along the lines of the bleeding, tourniquet. Man, there's some decent tourniquets out there for pretty cheap. So a lot of this stuff you can buy on the cheap. These aren't the most expensive kits to make, but if you ever have to use them, they're going to be the most important thing you ever put together. So, because it means your life. Trauma is not owies and boo-boos. Trauma is, I'm dying right now. So, it's more extra crap for the IV. Duct tape, because, dude, if I had to put a quick clot on there and an Israeli bandage and it's still coming out, I might try to duct tape that thing, but most likely at that point I'm putting a tourniquet on. But you might have multiple things. You know what? Duct tape comes in so handy that I have it in 3 or 4 different spots in my bag. So, back to the eye patch that expired. These are by 3M, Next Care First Aid. They're just eye patches and eye drops. Look, you gotta keep them from rubbing their eyes if they get, especially if they get like a sliver from shooting steel or something. just, you know, moisten the eye and get these on there. They're sticky as hell. I put one on the other day, just messing around to see, and get that eye covered, because they're probably going to do more damage by rubbing it than the actual injury. So have some decent medical tape in there, and then I have basically butterfly bandages and just an assortment of regular bandages just in case, and that's about it. That's what I run in my kit, and that is going to keep you breathing and hopefully stop the blood flow. Like, you know, if you're using all this and there's still blood coming out, man, it's a real bad day. But you know, you pretty much and if you know CPR and everything, you pretty much cover your ABCs, your airway, your breathing, and your circulation. So if you have any questions, hit me up. Otherwise, that's my trauma kit as it stands, minus the IV. So I'm in Bones, and I'm out.